everyone, it's Gina, your resident dental hygienist here. Have you ever walked outside in the winter and suddenly your front tooth just gets a zing, like a zingapane? Or even when you take a sip of hot coffee or tea or you bite into an ice cream? Same here. You are not alone. Did you know that dentists actually use temperature tests, either hot or cold, to help figure out what is going on with your teeth when they're sensitive like that? Today, I'm breaking down why hot and cold affect your teeth, and they affect your teeth differently, right? So what those reactions might mean for you and what we can do about it. Here's the thing, most sensitivity comes from exposed dentin, and that is that layer right underneath your enamel that contains these little teeny microscopic tubules that lead right into your nerves. So that's why you get that zing sensation. Cold and heat actually move fluid right into those tubules, which triggers pain receptors. That's called hydrodynamic theory. If it's the cold that bothers your teeth, like a cold stimulus, say ice cream or even cold air, that usually causes like a sharp, quick pain because cold causes fluid to flow outward and it causes it to flow really, really rapidly. Hot, on the other hand, causes like a really slow, dull pain because fluid moves inward and activates those heat-sensitive channels. Let me tell you what we do in the dental office for this. Say that you are sitting in your chair in the dental op and I'm checking your teeth, I'm probing. Sometimes what we could do is we use the air syringe to create a cold blast on a specific tooth, which if that's your problem, it does hurt, right? It sends that zing, but what it does is help us pinpoint which tooth it actually is, right? Otherwise, we just don't know. Another thing that we can do is we can place a warm cotton roll or even hot water on a tooth to test a heat response. And different reactions can point to different issues. And honestly, I promise that we're not trying to be mean or we're doing these things out of necessity. Sure, we can also take an x-ray that might tell us a lot, but at the end of the day, we do need to pinpoint exactly which tooth it's coming from to be able to help. And if you are getting that sharp pain of cold on just one tooth, that often signals dentin hypersensitivity, also called reversible pulpitis. But if you have pain for both hot and cold or pain that lingers, that can actually mean deeper inflammation, or it can involve nerve involvement like irreversible pulpitis, and it might need more investigation. Another tool that we use is called endo ice. We test each tooth with it. It's just a little cold spray. And by using it, we're actually able to tell whether the specific problem tooth gets a cold sensation in the first place and how long it lasts. This can tell us whether the nerve in the tooth is still alive or not. Let's talk about a few real life examples. So I had a patient recently that had just had bleaching treatment or teeth whitening, and immediately after, their teeth just sent a zing right when drinking ice water. That is a classic reversible sensitivity. We just managed it with desensitizing toothpaste and a fluoride varnish that we painted on, basically just a fluoride treatment that bonds with the teeth and helps to reduce that sensitivity. Another example is somebody having gum recession. They start feeling both hot and cold stimuli super intensely. So anything hot, drinking, eating, they just feel a really intense sensitivity. And then same went for cold too. Anything that they had that was cold, they couldn't really handle because their teeth were too sensitive. In this case, what we can do is we can check the areas, because some areas could need bonding or even a sealant to reduce that fluid movement and reduce the sensitivity as well. Okay, fun, all but painful fact. Some people get what's called thermal allodynia, where going from a cold environment to a warm environment triggers pain in their teeth, and it can literally last for hours. It's caused by nerve sensitization after repeated thermal stress. If you're somebody experiencing this, there are things we can do, like applying a protective seal or recommending higher fluoride, whether that's fluoride toothpaste or fluoride varnish, just to fortify the enamel and save you that terrible pain. So what can you actually do about it? Number one, using a toothpaste made for sensitive teeth. And don't just take their word for it on the package. Actually check the active ingredients. My favorites, what I always recommend for my patients, is checking for either potassium nitrate or for stannous fluoride, because those two have actually been clinically proven to improve dental hypersensitivity. Another tip is just making sure that you have a soft bristled toothbrush, that you're brushing very gently, because strong pressure over time can wear away enamel and can wear away gum tissue. And if you have problems going from hot to cold and vice versa, just try to avoid extreme temperatures, because those are going to make your sensitivity spike. And check your drawers. Are you using a whitening toothpaste every single day? That could also be a culprit and could be contributing to that sensitivity, and might even cause more abrasion or that wearing away over time of tooth structure. Another thing you can do, drink hot thirst quenchers through a straw, or just sip slowly to minimize that contact with your teeth, especially if you love iced tea, or like me, if you love hot tea on a nice cold day. And of course, if your sensitivity persists, you need to go in, see your dentist or hygienist, and especially if you have lingering pain or really severe pain. So listen, next time your teeth talk back to that frappuccino or latte or hot tea, whatever you like to drink, you'll know there's more happening under the surface. And remember, your reactions help us figure out what's actually going on inside that tooth. So tell me, if you've experienced dramatic hot or cold sensitivity, please share your story in the comments below. And if you have any questions, don't hesitate to also comment. Don't forget to like and subscribe, because we have new dental mythbusters, wellness tips all the time for you, at least once a week. So please subscribe so that you can get more. And until then, take care. I'll see you next time.